The taxpayers have a right to know that their money is going to the right place. And so we're just starting this process.
It's been more than 2 months since Republican State Representative David Steffen says former Newcap employees came to him with concerns about how the organization was using taxpayer money meant to help low-income residents. He wrote a letter to the Wisconsin Department of Administration on December 17th requesting a review.
I've been giving the Department of Administration as much time as possible. I think it's about time that we start getting some accelerated and more comprehensive answers from these folks.
Fox 11 has been told the DOA started program and financial administrative reviews of Newcap on September 22nd, almost 3 months before Steffen sent his letter. Those reviews also started weeks before Baker Tilly released its independent audit of Newcap for 2024. It found, quote, substantial doubt about the organization's ability to continue. That year, Newcap received $13.9 million from the government for its 10-county service area, money meant to help people with things like housing, home weatherization, and health care.
The first step is figuring out whether Newcap can be saved.
Democratic State Senator Jamie Wall says he's been speaking with Newcap officials about a review of the organization's finances that is currently happening. That review is being done with the help of members of Newcap's executive board, members of the individual community action agencies in the state, and officials from WSCAP, the statewide network of poverty-fighting agencies.
They're digging into the books and trying to have an accurate picture of the organization's finances, and then they can make a decision of whether Newcap can recover or needs to be simplified or slimmed down, or whether it would topple into bankruptcy. I haven't seen the books, but I talk to people about the situation, and it doesn't look good.
Of all the people Fox 11 Investigates has spoken to, no one expects CEO Cheryl Detrick to return to the organization. Before she was put on administrative leave, she declined our request for an on-camera interview, but agreed to answer our questions over email. She maintained Newcap followed all government requirements that came with the money it received. An open records request Fox 11 made to Wisconsin Department of Health Services is providing examples of the requirements Newcap is supposed to follow. Most of the grant agreements call for compliance checks in the form of monthly or quarterly reports. A former Newcap employee with decades of construction experience tells Fox 11 when it was time to provide those reports, leadership would gather in a room and often come up with numbers seemingly out of nowhere. Evan Dudick, who worked in interim housing at Newcap, shares a similar experience.
I was being asked to give numbers that just did not exist. I saw other departments. I saw my department. And just at a glance, most of it didn't even make sense of what's going out as to what's coming in. But then all the department heads are being told make sense of it.
Before she was put on leave, Detrick told Fox 11 reported outcomes are drawn from required program data systems and reviewed by leadership prior to submission. She also says Newcap has not received any formal findings from funders indicating that the organization has fabricated reported service numbers. That leads us to another important question. Is the government following up on the requirements it lays out when it agrees to give out grant money to ensure the money is being used properly? Through our open records request to DHS, we looked further into one grant that a former employee told us was concerning. The state provided Newcap $100,000 for suicide prevention. The 49-page grant agreement states Newcap was to use the money to implement digital literacy programming for rural men aged 25 and older, as well as install telemental health kiosks at its facilities in Marinette, Shawano, Forest, Vilas, and Oneida counties. The grant agreement states Newcap had between February 1st, 2024 and January 15th, 2025 to install the kiosks and provide picture proof. Fox 11 asked Detrick specifically about the kiosks in Marinette and Forest counties. She admitted the one in Marinette was installed approximately in June of 2025. That's 5 months after the deadline and 15 months after Newcap received the state grant money. She says in Forest, technology was deployed in phases during fall 2025 with updated equipment in place by mid-January 2026. That's a year after the end of the government's given time frame and nearly 2 years after Newcap received the state grant money.
If that's the case, that's a failure, right? It's a failure of oversight and it's a failure of service delivery, and I think we should expect more.
Despite what Detrick told us, our records request shows Newcap told the state in January of 2025 it had all 5 telemental health kiosks installed, meeting the state's imposed deadline. A Microsoft Word document shows a picture for each kiosk. However, the properties for the document show it was created in October 2025, 9 months after the state-imposed deadline. We couldn't find any proof in the records that the pictures were sent earlier.
A picture? That's the verification process? That's the accountability? Were they even plugged in? I mean, what type of activity was actually occurring on those kiosks?
We went into the Marinette Clinic January 14th to try to verify whether the kiosk was installed. An employee told us she couldn't show us without authorization. A source tells us while the kiosk was operating that day in Marinette, our check led Newcap leadership to put the proper equipment in its Forest County location.
This is so sad. There are people who need those services, and the public has expected them to be provided. And the state and Newcap have failed in their requirements to make sure that happens.
We asked DHS if it was satisfied with how Newcap used the money for the suicide prevention grant, whether it was satisfied with how Newcap has used other grant money, and whether it took any additional steps to monitor Newcap's use of grant money in response to concerns that have been raised. DHS told us it would not be able to provide answers by our deadline for this story. We emailed the questions 2 days before it aired.
I think there's a lot of creative word salad, grant writing to get money out of the government, and then for what? Where's the metric that shows that even is of value to the people?
Steffen says he'd like Wisconsin's Joint Legislative Audit Committee and Committee on Government Accountability and Oversight to become involved. Wall says he also sees room for improvement.
We need to take a hard look at some state policies to make sure we minimize any risk, and we need to take a hard look to make sure that money is being spent effectively and helping the people that we want it to help.
We're told the WSCAP-led financial review for Newcap's executive board is expected to be done within the next week or two. One thing everyone seems to agree on is the goal when this is all done is to keep providing the important resources for low-income residents, whether that's through Newcap or a different agency. We're going to continue to keep an eye on this situation and provide you updates as we have them. For Fox 11 Investigates, I'm Ben Krumholz.